office. We'll be here for a month of Sundays. But welcome, and I look forward to being with you.
Me too.
Okay.
I appreciate it. Thank you very much. Okay.
All right, Dawn?
Okay. Okay. So we're going to do her neck, his neck.
I'm going to take this off. And,
now, I told you his neck is out here to the left. So what I've got to do is his neck is out and down just a little bit. So I've got to thrust this neck up and over that way. And I don't need to use a lot of force, but I need to be consistent with how I do this. If I do over thrust, I'm actually going to push it too far the other way. If I do under thrust and stuff, I'm not going to have him adjusted. But the other thing is I've got to get this down here. Now, those of you that may have felt his muscles earlier feel that these chest muscles are totally different now. They're back pretty much about even, okay? So we've still got this horse that's got his neck out here, right here. And if I take my thumb and go right in there, see that? He throws his head that way. Now, if I go down in here, right in through here, is a little tender yet. It's not as tender as it was because we've gotten a lot of this shoulder issue out, straightened up. So we come down in here and let's get his neck first. We want to get up here first because this is the major function of his neck, is to move down, up and down like this with this part of the neck. So what has to happen is we've got to get him relaxed. So I just get him to relax his neck, which is sometimes easier said than done. I just get him to just move his head around and just relax. Because I'm going to take a quick movement on him, easy, and he'll anticipate a little bit. So watch I don't pull the rope through your hands. Easy, easy. Easy, easy. Yeah, notice he's chewing. Feels better. Come on up here. Come on, bud. Come on. It's all right. It's all right. Let's get this straight first. Easy, 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 easy. 1, 2. Yeah. Check up in here whether we've got it. See that? He's not throwing his head. He's actually starting to lean into the needle a little bit. Now if I take my thumb here, I'm burying it even tighter than I was before, and he's not moving. And when I feel across the top, it's even from one side to the other. Okay, so I've got it here, but I've still got to get this down here. So I'm going to try to do is to work these vertebrae in. Easy does it, just a little bit at a time. Easy, easy. Easy, easy, I know. I think I got it right there because he chewed. It felt like it. I know. It's all right. It's all right, buddy. It's all right. Relax. 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 It's all right. Yes. You're very good. Yes, you are. Good boy. Yes. Okay. Right there. There it went. It's all right. It's all right. We're just trying to move your neck around here. That's the boy. Let's bring him up here. Just want to move your neck around here, buddy. That's all. We're just going to move it. That's all. That's the boy. That's the boy. Easy does it. I know it's hurt for so long. Yeah. Yeah. Good. Okay. Come on up here. Come on up here. He's being a very good boy. Some of these that have had their necks out for a long period of time, I've seen them where they just basically, this is very, very painful for them. And you put that back in place and they just drop their head and just about fall asleep on you. Easy does it. We're not doing anything more with it. Just massaging a little bit, okay? So what I do is after I do that a little bit is I massage that a little bit and let them just relax. There's a point right behind the ear called gallbladder 20. It's a major point for opening up the blood flow to the head, but also relaxing them down. But some of these horses also have what's called TMJ, temporal mandibular joint problems. And so they tend to have a hard time chewing on things, or they may not eat things right because of this neck being out. So you'll massage this and these horses just like, oh God, that feels good. And they feel so much different because their jaw feels better. See his head coming down? I'm not pushing it down. He's bringing his head down on his own. Because that feels so much better right there. Good boy. Good boy. Yes, good boy, yes. Doing good. Now, let's take a look at things here. His tongue is not lavender anymore. His saliva is just a little sticky yet, but his gums have become a little pinker. Now let's see what his pulses are like here. Come here. His pulses should change just from doing the chiropractic on him. So when I'm checking pulses, there's different ways as far as pulse therapy on horses is to learn whether to do it on the jugular or the way I do it. I learned from one of the masters that I'd studied with on checking my pulses against the horse's pulse. And it makes a difference because I can actually feel whether things have actually changed pretty dramatically just by feeling my pulses against the horse. And it has. His kidney pulse is up, his liver pulse is down, and his spleen pulse is more steady. So what I'm going to do is I'm going to put some needles in him. And the first place I'm going to start is in his one back here in his back and a couple in his feet. And the reason is because these ting points down here, these actually feel better already, but the ting points down here are right where these meridians start and end. So I want to stop and right where they stop and start. So that's where I want to make sure that these meridians are opened up all the way along here. Yeah. So what I'm going to do is I'm going to get a thermographic image on his body again and see what things look like after we've done the chiropractic, and then we'll do acupuncture on him. Yeah, let's move him over in the shade just a little bit because the sun will have a little bit of effect on it. Right there, that's fine, perfect. Much better. Back his foot up just a little bit. Looks like a lot of pain in that hip yet. Okay. Okay. Let's shut that off a second. Okay, let's bring him back over here and we'll get some needles in him. Okay. Okay, first things first, what I'm going to do is we've had an issue with this pelvis and lower back here. So what happens is you get blockage of energy flow from the back end of the horse to the front end of the horse. So what I'm going to do is I'm going to open that up and I'm going to put it in with one